Weaning can be a very exciting time for parents and babies alike. Through this video, we hope to share with you how to introduce solid food to your baby.
We will also be sharing with you advice on when, what, and how to feed your little one during this weaning process.
For newborns, breast milk is the ideal form of nutrition. In fact, the World Health Organization recommends that mothers exclusively breastfeed their babies for the first 6 months. As a baby's nutritional requirements continue to grow, complementary foods should be introduced. Do take note that weaning before 4 months of age is not recommended, as a baby's digestive tract and immune system have not fully matured. Delaying weaning to beyond 6 months is also not recommended, as it may increase risk of nutritional deficiencies and feeding problems.
Signs to indicate that your baby may be ready for weaning include adequate head and neck control, ability to sit well when supported, disappearance of the tongue thrust extrusion reflex, increased drooling and putting things into mouth, interest in food and/or people eating. Before starting weaning, it is important to make sure your child is seated upright. Use a feeding chair with adequate head and body support. You may also use rolled up towels or pillows to better support your child.
Starting your baby on iron-fortified, milk-free, single-grain cereals is preferred as a first food. By adding your baby's usual milk, the taste will still be familiar to your baby.
Mix enough milk to ensure that the consistency is thin but still slightly thicker than milk. The mix should also still be able to flow from the spoon.
Apart from cereals, pureed meats are also excellent source of iron for your baby. To puree foods, first boil the piece of meat and add enough water or milk to blend to a pureed consistency. You may also use a sieve after blending to sieve through lumps to obtain a smooth puree if required. Only introduce one new food at a time and monitor for signs of food allergy for over 3 to 4 days before introducing another new food.
Picking the right weaning spoon for your baby and using it properly are also important for weaning. For babies who have just started weaning, we usually recommend soft and shallow weaning spoons. To use a weaning spoon properly, present the spoon straight when putting it in and when taking the spoon out from your baby's mouth. Wait for your baby to close his or her lips over the spoon to remove the food. Do not scrape the spoon against the teeth or lips, as it does not teach your baby the right spoon feeding technique.
If during weaning your baby shows signs of wanting more food, you may increase the quantity of each meal. However, avoid force feeding. Once your baby is able to take about 3 tablespoons of solid food, it is sufficient to replace a milk feed.
You may also increase the frequency of spoon feeding to 2 to 3 times daily to help establish meal times that are similar to your family's meal patterns.
We hope this video can help you better understand how to introduce weaning to your baby. Remember, avoid force feeding and be patient with your baby when introducing new foods.
Watch our next video in which we will share with you how to teach your baby to chew, self-feed, and drink from a cup and straw. Thank you for watching.